In this video, I'm going to talk about self-harming. It's not an uncommon thing in other countries, like, for instance, England, where I have worked, and we used to see this quite frequently. However, in Sri Lanka also, we see this. Now, what is self-harm? A common form of self-harm that we see is self-inflicted incisions or cut wounds to the forearm. So if you are right-handed, for instance, you will get a blade or a knife and you will cut your left forearm. Why might somebody do this? There is a condition called borderline personality disorder. It's a personality disorder. What is a personality disorder? Personality disorder is a problem of your personality. It is a problem that is ingrained or that is there within your personality. And of course, though it can be treated, as we will talk about later on, it takes some effort to treat this. So, some certain people can incise or cut themselves, and some of them actually have borderline personality disorder. Now, it is said that these people have a tension, psychological tension within them, which gradually escalates, and once you cut yourself, that subsides. So, when this condition affects somebody, they might actually be resorting to this behavior quite frequently on long-term basis. So they might therefore need specialized forms of therapy, specialized forms of psychiatric treatment to get this problem treated. Now, when you have a personality disorder, actually it is not only you who suffers, it is also the people around you. So there are social consequences to your family, consequences to your friends and relatives, and certainly not only you. So the final message of the video is that if you know of anybody who might be suffering from a personality disorder, or who is engaging in cutting or self-inflicted harm, self-inflicted wounds, self-inflicted cuts to their body parts, if you will have to get in touch with an experienced doctor who will treat this condition effectively. Of course, it might take some time. So that is the message in this video.